today's session is about communicating bad news. It's all about the material we're going to send you, this one, and you're supposed to read it and learn from it. What I'll do is not read the entire thing, and I wouldn't do that because that would take about 1 hour, and you won't last 1 hour looking at your small screen. And that's the reason why TED Talk doesn't last 1 hour, and that's actually looking at a person on the stage. The first thing I need to tell you is where the material came from. The material came from a workshop developed by the Americans and the Canadians during the late 1980s and the early 1990s, and it's a workshop for end-of-life care, meant for all physicians. So it's a 2-day workshop, and then the question is, if we only have 2 days and about 10 to 15 topics at the most, what topics do we need to teach all these doctors? So out of all the possible topics in hospice and palliative care, what are the most important topics that we need to teach them, or everyone should learn? And if you look at the list of topics, it's surprising that about 1/4 to 1/3 of all the topics is concerned about communication. And one of the most popular topics would be communicating bad news. Palliative, it's not because hospice and palliative care is all about communication. No, if you look at the references in the journals of hospice and palliative care, it's not all about communication. But everyone noticed, or at least the hospice people noticed, that one of the root causes of all the suffering and the problems in taking care of very sick and potentially dying people would be the problem with poor communication. And it's hard to start taking care of hospice patients if they're not well informed. If they're not well informed about their condition. You cannot do good hospice care if you don't inform the patient about their condition. So you'll be asking, why are you teaching me communication? That's a topic for grade school and high school. I mean, even the steps don't look that sophisticated. I mean, they're very, very simple steps. How come we're watching this? I think I already know that. Now, the reason why we're repeating it is because there's a huge problem in modern medicine nowadays. What I think is doctors are so used to doing something that's guaranteed, like you have evidence and it's guaranteed to work for about 70% of the time. They want something like that. And communication is not like that. It's very difficult emotionally for the doctors. And so what happens is they feel very inadequate and they want something more certain. They want more training. So the biggest news I can tell you right now is even if you memorize this entire module, it will still be difficult. But at least the module might help with. The module presents you with a 6-step protocol. This is the most popular protocol there is. Now, some people spiced it up and made it more sophisticated. So they broke down, they turned 1 step into 2 steps, or 1 step into 3 steps. So there are 6 steps or 7 steps or 8 steps protocols. This is not like biochemistry and you're supposed to memorize stuff. This is not it. The material is simple. The hard part is trying to learn it, master it, by practicing it. That's the hard part. This is a skill. The material usually starts by telling you what people expect. And it gives a list of what people want. Of course, the list would contain something like they want you to be honest, they want you to be sincere, they want you to tell the truth. They don't want you to say it in so many words that it becomes confusing. They want someone who can understand how they feel. So empathy is actually a big thing. If you look at the list and you look at the 6 steps, what you'll probably notice is the 6 steps are not going to solve, are not going to deliver what they want. Steps are not going to guarantee that you will have empathy. Okay, so a lot of those in the list are actually based on values, morals, values, attitudinal. So we'll start with the 6 steps. For example, you wrecked your mom's car. You wrecked your mom's car, and it's her favorite car. It's really old. It's like 12 years old. You've been telling her to just get a new one. She can afford it, but she doesn't want to because it's her first car. So it's her favorite car, and you wrecked it. Bumped a signpost, and the front looks really bad. So the question is, how are you going to tell your mom? Okay, so now this has nothing to do with sickness or illness, but I'm using this example to convince you that the steps are very simple. It's very easy to understand. It's universal. Even if I don't tell you the steps, you're actually going to guess what they are. These are the same steps you'll use when you tell your mom you wrecked her car. Okay? These are the same steps you will use when you tell your best friend that her boyfriend or her girlfriend has been going out with somebody else. It's bad news, right? Now, if you're going to tell your mom, what's the first step? You need to prepare, right? So step 1 is you try to figure out how you're going to tell your mom. When are you going to tell her? after dinner, lunchtime, you try to figure out whether she's in a good mood or bad mood. Maybe she has a bad day at work. Well, maybe that's not a good time to tell her. Or maybe you should tell your dad first, right? Well, before you tell her, you have to figure out whether she knows it already. Hopefully, she doesn't find out, but maybe she did. Like, for example, she suddenly arrived in the house and the car was on the side, and you don't know whether she noticed it or not. Of course, she'll probably say something about it, but you don't know. So you want to figure out how much she knows. Maybe your dad saw the car outside, and then he called her up right away. For a sick person, ask them what their other doctors have told them so far. If it's a really, really bad prognosis and bad outcome, like terminal kind of outcome, death outcome, you want to feel things out. So you want to figure out how much the patient can take, if they're emotionally prepared, how much detail they want about the bad news. Like a lot of details. You have this cancer and spread to your bone, to your brain, to your bowels. You're going to throw and recite to her all the pathophysical about does she want that? Does your mom want the entire thing? I was driving and then I saw this cat and I swerved towards the right, and how much detail does she want? Okay, or how much detail is appropriate? You want to give them a chance to tell you what they're prepared to hear. Sometimes the family will tell you not to tell the patient the bad news. And actually, this material has something about that. When the family says don't tell, so what do? Figure out why they don't want you to tell. So what are the reasons? I mean, families have several reasons. And most of the time, they're very protective, and it will make her depressed, and they don't want that, and they will make her more sick. And then you kind of explain to them it might be better if you tell you tell her. You try to work things out. Maybe some of the reasons are valid, and then you come up with a plan. And you try to balance her right to know, and because it's hard to take care of someone who doesn't know, right? It's actually near impossible to take care of someone who's dying without telling them they're actually dying, because they can actually sense it even before you tell them. And there's research to prove that. So you try to probe what their concerns are, and you work it out with the family. And then comes delivering of the bad news. Again, the first advice is to not just blurt it out. So, you're gonna die. Okay, don't do that. Not to blurt it out. Give them a warning shot. So a warning statement, a short phrase or one or two sentences. Like, for example, the shortest one here would be, "I'm afraid that the news is not that good." That's pretty much what it means. Okay, prepare yourself. I'm going to tell you. Of course, when you were asking them if they want you to tell them, they already got a hint. It's really bad news. So this is the last warning statement. So warning shot, and look at the patient, say it gradually while emotionally supporting the patient. So after they deliver the bad news meaning a news that provokes a severe emotional distress, what happens next? Well, you get emotional distress. That's the reason why it's bad news. Respond to the emotion and support them emotionally. Try to help the person in front of you. Why? Because you're the doctor. You're supposed to take care of the person, right? So not just tell them the information. I mean, a computer can do that, an email can do that. You're supposed to take care of someone, and this person is now experiencing a lot of distress because of what you just said. Okay? And this is the hardest part, and this is the reason why doctors don't want to disclose to their own patients, and it's probably the reason why we'll try to refer to hospice for the disclosure, but it doesn't work. I'm going to refer you to hospice, people who takes care of dying people. And why am I dying? They'll tell you about it. It doesn't work, right? So especially nowadays, everybody knows what hospice is. So you cannot just bluff. Like, I'll refer you to a certain group of people. Who are they? Oh, they'll tell you themselves. It's a secret. And you can't do that. And it's not done that way. The people who started hospice and palliative care didn't do it that way. Okay, so they did the workshop, but the workshop is for the people who are referring to hospice and palliative care. It's not meant to tell everyone, okay, we're so good in this, don't disclose, we'll disclose for you. That's not the message. This is a workshop for all doctors. It's like ACLS. You have to know ACLS. We're not doing the workshop to tell you that you usually refer to us when the time comes, because most of the time we're not there. The reason why people don't want it to do it is because it's so uncertain. This is the most personal thing, and doctors are not used to emotions and personal stuff. Solving the problem. We're used to facts, problem solving, and doing something to solve the problem, right? their symptoms, their test results. You put things together, you come up with a differential, then you figure out what it is, you figure out what to test, and you figure out what to do, and then it goes away, and everything goes away. That's pretty much what we tell everyone. And unfortunately, we tell everyone that it happens all the time. And unfortunately, it doesn't happen all the time. Some of them do get worse and worse, and some of them get really debilitated, and some of them end up dying. And so comes the bad news. Who's going to tell them that? People are unique individuals. The doctor is an individual who experiences a lot of distress about what he's about to say, who's reacting to the situation himself. He feels like he's a failure. He's scared about what the patient will do. When the patient starts crying, he gets more scared and he starts sweating. The patient is also scared, of course, definitely. If somebody tells this person, you might die, or you will probably die, or you'll end up with a really, really terrible disability, or like your life will get short, it's going to be very scary, right? So, or we're not sure, maybe you'll get better, but most of the time you don't. Okay? So if you have cancer, we can only cure 25% of all cases. So hopefully you're the 25%, you're not the 75%. I mean, who's going to feel good about that? And it's just the truth. I mean, you cannot just say, oh, don't worry. That's not true. I can't say that because it's the truth. So the bad news is real. So they cannot correct misperception. There's no misperception. I mean, there might be, but even if you remove all the misperception, there's still a bad, terrible news. So the question is, how do you solve that? How do you make the person feel better? Now, as doctors, we're trained to do something to make everything go away. And so in our minds, if I cannot think of sure thing to make the distress go away, then I'm not well trained. Even if you mastered 10 great statements to say when somebody starts crying, it's not guaranteed to work. Right? So, and not everyone cries. Some people shout, some people get angry, some people get mad at you because you're one of them. Okay, so you didn't treat me well. So it's very difficult, it's uncertain, and doctors hate uncertainty. They want something they can do. It's guaranteed. Even if the results are uncertain, at least they know the chances of it working. Is this person going to cry? Is this person going to get mad at me? Why is this person not talking? What is she thinking? What do I say? Tell her now. And it's even worse if you're looking at 3 people, like the patient, the husband, and the child. And that's 3 people exhibiting a lot of emotions. So that's the reason why this stage is very hard. Now, what I can tell you is this: if you already know them beforehand, you've been taking care of them for several weeks now, or maybe several months now. If you paid attention to their person and not just to the disease, okay, when the time comes when you have to tell them the bad news, you're in a better position to pick the right words for mom, for dad, for the child who's really crying, because you already know them and you understand what they're feeling. So what's that? Empathy, right? The last step is wrapping up. So how do you wrap up a meeting or a discussion? You summarize, right? Now, make sure that they understand the highlights. Like, we talked about this, and this is what you said, and we agreed this is our plan. So I told you that I wrecked your car, and this is what you said, we got mad, and then I wanted to do this, and we agreed that as a punishment, I'll do this for you, and I'll take your car to the car mechanic and to the body shop. And so that's the summary, and that's what will happen next, to orient everyone, or to put everyone on the same page. So this is our plan now. And then that's the end of the module. You still have to read it. What I can tell you, and it's not very clear here, is and it's a common misconception. Bad news, or breaking bad news, or disclosing bad news, does not happen only once. It should be happening several times. So for example, okay, when you tell someone they have cancer, that's bad news, so you'll be disclosing. When you tell someone that the first attempt is not working, or there's a complication, they get scared. That's a scary occurrence. Nobody expected that, or we told them the risk, and it's now the risk of a complication is actually happening. It's reality. So that's scary. So we don't want, people don't want that. So that's another bad news to deliver. And then they get better, and then you try out the second round of chemotherapy or treatment, and they start getting better. and then you're happy. And then after 1 year, it recurs and there's metastasis. That's another bad news. And so you try your best, and then don't worry, we'll do this. There's still a chance. Okay, so the chance is about 25%, but we'll pray, we'll hope, and of course, everyone wants to be positive. And then, unfortunately, it didn't work. They're not the 25%. They're the 75%. So now you have to tell them that it's not working, and there's no other choice. That's another bad news, right? So, and then they go home, and then palliative care takes care of them, or the hospice people takes care of them, or if there's no hospice and palliative care in their town or community, the family doctor or the general internist or whoever is there is doing good primary and secondary end of life care, right? And the patient's doing well. And of course, when your mom who's sick is doing well, you think that's pretty much how it will go for the rest of your life. And of course, that's not true. Your mom, and then your mom gets worse, and then it's a pneumonia. And so the hospice doctor comes in, but she might not make it, but we'll try. So that's another delivery of bad news. Okay, and then she gets better. And then the third complication is really bad, or there's nothing left that they can use to prolong your mom's life. And this is imminent death. I mean, unstoppable death. And so your mom is dying, and she'll probably die in the next 2 weeks. Or your mom is dying, she'll probably die in the next 3 days. That's another bad news. So it's a series of very distressing news. So it's not just one bad news, or it's not just one session. The misperception is it's just one session. Why? Because they think, well, that 6 steps is not for that. Well, the news is this basic 6 steps is for any kind of distressing news. It's for any kind of distressing news. The misperception happens because the people lecturing the 6 steps are hospice people. So everyone thinks we only need to do the 6 steps when we're about to tell this person we cannot do anything more, we'll refer you to hospice. But that's not true. Practice well, and you have to deliver all the bad news that you would need to deliver throughout the course of the patient's illness with concern, with compassion, hopefully doing all the right steps. Last thing, if you memorize this and you say the right questions, you'll pass the written exam, you'll even pass the practical exam. Okay, you'll pass that, right? But in real life, there's non-verbals. I mean, it's not what you say, but how you say it. So it's a skill. Therefore, you have to keep on practicing it. If you just do that, right, then what will happen is you'll forget all about this, and you'll copy everyone else. And unfortunately, everyone else don't do this. And so we have the same problem as before. The same problem why it got into the workshop. Doctors are not disclosing bad news well. And it's so hard to take care of them afterwards. Okay, they get distressed, they get confused, they get sad, they get angry, they get fearful, they get anxious. One of the root causes of all the problems related to taking care of someone who's terminally ill is poor communication. It messes up the clinical management, the emotional support, the counseling, the decision making, and much, much more. So that's why it's here. So now I'll show you a few supplemental materials. The videos are nice because I know internet connection is really bad. That's the reason why I'm doing this like this. So I can even send you this video. Lectures on the topic. You'll be surprised. There's tons of them. I mean, people talking about the same thing. Different accents. Florida, Boston, California, New York, India, Korea, Philippines. And each one of them would have a different flavor. It's the same steps, but they have their own take, right? So let me warn you, these statements are not universal. They say, does this news frighten you? Okay, so, and someone from Boston might say, well, I placed it there because it works all the time, or it works a lot of times. And someone from Minnesota will say, no, we're not going to say, it's not going to work here. I mean, we don't say such things here. Or someone from the Philippines will go, I don't think that statement is good. If you do that and we Tagalize it and then say the same thing to a Filipino person, it won't work. I mean, guaranteed. So these statements are sample statements. So don't memorize the statements. Try to figure out what it's attempting to do. And pick your statements not based on the reference material. Pick your statements based on the person in front of you. How well you know the person in front of you. What's happening with the person right now. So you keep on practicing. Now the problem is it's COVID. So how do you practice? I mean, how do you practice with COVID? You're stuck at home. I mean, you're looking at this screen, and now your eyes are really getting tired, and you're sick of my face. So, but good news, you can switch it off, and then you can watch the video lectures I used to do the previous years, which I cannot do with this format. If you want to hear that, then you can. I'll show you the links if you want to hear that. But I try to make it simple. This is what you need to learn. If you want more of the stuff, or you want me talking more and on the videos and the pictures there. Again, I admit I'm not the most outstanding lecturer of this topic. Although I hope I did a decent job. So aside from my videos, I'm going to give you a list of other videos that I think are good. I'll send you some reference books, a couple of reference books. I know when we were in med school, we hate reading a lot of stuff, especially stuff which are not very medical. You know, like some of us, if it's surgery, we get excited, we'll swallow the entire book. Or those of us dreaming to become nephrologist, and it's internal medicine time, we swallow the entire book, right? So now if it's family medicine or hospice care, and it's like communicating bad news, setting goals, and things like that, we go, what the heck is this, right? So we don't remember half of everything, or like 3/4 of everything. So hopefully it doesn't happen. So read the material. You can always look at our textbooks if you want more, and then you keep on practicing. So how do you practice? So it's COVID, so you cannot practice. Without COVID, you'll be talking to patients and things like that. But now that we have COVID, then you cannot do that. Okay, so you practice among yourselves. You know, it's hard to practice looking at the screen. I mean, you don't see the emotional reaction. The other thing that you can do is you can ask your mom or your dad to play. Think of a bad thing you haven't told them yet, and then you deliver the bad news to them, right? Or ask your brother. Okay, maybe you did something bad that you haven't told your brother yet. Okay, so and then practice delivering the bad news, right? I'll follow the steps and do it well. Or if that's not even possible, you can do the empty chair. You 2 chairs, one is empty. Imagine that you're sitting there. So there's 2 of you, the patient and the doctor. Imagine that you're sitting there and tell yourself one really bad news. Okay. Imagine you haven't told your other self the bad news, and your other self is hearing this bad news for the first time. And then so you do it well. You imagine how your other self is reacting, etc. Do it as well as you can. And now transfer to the other chair. Now this time, imagine or recall what you just said, and then react as a patient. Okay, you're reacting to the words you just said before. So now this part makes you learn empathy. So this is the part that makes you understand the person. Okay, the other way of doing that is watching videos. I'll give you a link of the videos I use. I actually use videos. So the idea is you watch the video, and then you look at the doctor, and then you try to figure out, if I was the doctor, would I do the same thing? Would I do the same thing? Or would I do something different? And then I look at the patient, and then what are the emotions? What are the thoughts? What are you thinking right now? Look at the facial expression. So it's a practice in understanding and empathy. It's a way to practice yourself. Now, after COVID, you do the actual thing, which is more scarier. This is a real person with a real problem that can really kill them. And these are real, unpredictable emotional reactions. So that would be scarier. But you have to do it. And my suggestion is, even if you're not in hospice rotation, even if you're in some other department and it's not a big deal, like, just blurt it out and get it over with. Hopefully there's no such department, but if you're in such a place where the culture is like that, try not to do it. Try not to do it. Still try to do the compassionate thing. Okay, so still try to do the compassionate thing. Keep on practicing, so by the time you're graduates and you're the boss and the person goes to you hoping that you'll take care of them, it feels, and by that time you know how good it feels if you do disclosure well, with caring, empathy, and compassion.